Hi everyone, welcome to today's webinar. We're going to be talking about healthy workplaces. We have a toolkit that we've developed for the LDAT program. I'd like to begin by acknowledging the traditional owners of the land on which we meet today, the Wurundjeri people of the Kulin Nation, and acknowledge their elders past, present and emerging, and also recognise National Reconciliation Week. It's a great time of year to go out and get involved, so have a look on Reconciliation Australia's website for more info. So today we're talking about the Healthy Workplaces Toolkit, as I mentioned. Today I have Laura Bajoni with me. I'm Shayla Stammers. We both work within the Knowledge Research and Insights team within the ADF. I apologise if I say any acronyms, so if there's any new people in LDAT teams that have recently come on board, please say something in the Q&A box and we'll happily clarify. A little bit of housekeeping, we have a 30-second delay, so we're hoping that people will engage with us online throughout the presentation, and we can have some questions banked up either throughout or at the end of the presentation. So don't be afraid, please let us know that you're there, and also let us know if you have any questions or comments. Okay, cool, so let's begin. So essentially all of our toolkits and resources for the LDAT program are located on the Community Hub. In the Plan tab, so if you hover over Plan on the home page, you will see a list of things come up. One of them is toolkits and webinars, and the other is LDAT resources. Mm-hmm. So if you have a look in there, there's really useful tools in there for any CAP that you might be implementing. We encourage you to have a look at all of them. I know that there's like over 20, but it really gives you an idea of the scope of things that you can do in your community, and also, I guess, how one might relate to the other. So for example, within Healthy Workplaces, it would also be relevant to have a look at the evaluation resource and the ethics resource, for example. So they all kind of speak to each other, but we'll touch more on that later.
And the new stigma resource that'll be published soon.
Yay. Thank you, Laura. Okay, so today we're going to be looking at an overview of the actual toolkit, and then we're also going to have a deeper look at the 4 sort of focus areas that workplaces can focus on to improve, I guess, awareness of AOD harms, and then also prevent and manage, I guess, any issues that might come up as well. And yeah, I've already mentioned, please let us know if you have any questions throughout, and we'll try and talk to those.
Yeah, I've got the Q&A box open right here, so even though there is a 30-second delay on us reaching you, the Q&A is instant.
Yes, that's true. Okay, so as with all of our toolkits, this one is laid out in a similar way. We have an overview of healthy workplaces and just talking to some of the issues in this area of the community, I guess, broader community, how to plan for a project or a CAP within this space, mapping your steps, and then measuring your success and next steps. Typically at the end of all the toolkits, we have a little bit more information for people to read on, so we have that in this one as well. So have a look. Okay, so overview, I'll go to you, Laura.
Yeah, thank you. So in terms of the overview is essentially, why are we talking about workplaces? And it's because we know a lot of Australians work, and a lot of Australians spend a significant amount of their time at work. And people in the workplace are essentially a captive audience, so it is a really good opportunity to reach them with messaging about alcohol and other drugs. We know that the majority of working age Australians are in some kind of paid work, and many of us spend up to a third of 5 days a week or more in that workplace. We also recognize that certain professions and certain workplaces are at higher risk from alcohol and other drug-related harms. And as LDATs are considering if this is the sort of avenue that they might like to go down, or they're reaching out, looking for partnerships with employers, I did want to emphasize that part of the what's in it for us angle when you're looking for those partnerships is recognizing that employers do have health and safety responsibilities to their employees. And part of that is around alcohol and other drugs. So that can be a good sell when you're speaking to employers about the impact that alcohol and other drug use can have on their staff and on their workplace in general.
And it can fit into that space of post-work too.
Absolutely.
Obviously you won't, I assume that a lot of places don't drink during their work.
Hopefully not.
Some of them might. But in terms of those sort of casual catch-ups afterwards or events,
absolutely,
that responsibility extends beyond the 9 to 5.
Yeah, and it comes back to that, what's the workplace culture? And we will delve into that a little bit into the presentation. In terms of the planning section, we've laid it out, as with the other toolkits, really encouraging LDATs to identify activities that already exist. What already has brand awareness, so to speak, whether that's like a Feb Fast or a Dry July initiative. What kind of resources can you tap into so that instead of creating your own, you can access someone else's resources and then put your energies into building partnerships and working in the community. We recognize that there are different government agencies in every state and territory that are responsible for regulation and enforcement, so we do lay those out in the toolkit with links to that specific organization because they are state-based. And then we suggest some partners. In this case, it's going to be things like your local employers, maybe unions, even EAP providers could be a really good angle to getting into a workplace since they're already concerned with staff health and safety and well-being. And then we list off some indicative resources and start to talk a little bit about measures of success at the end of the planning section.
So
and
that's just linking objectives to your measures of success, so your evaluation. So the reason it sort of comes up twice in the toolkits is because it's really important to think about how you're going to measure whether or not you've achieved your objectives at the start.
Yeah, absolutely.
I think it can come across as a little bit repetitive maybe in some of the toolkits, but I think that's how these sort of activities often roll, is that you end up having to think about it a couple of times, and it's sometimes even iterative. You might replan something because you haven't been able to find a way to measure it. So anyway,
it's all about being adaptable, and that's actually a good avenue to throw to you for the next slide.
Sure. So talking about mapping your steps, I guess the first thing is to prioritise the high-risk occupations or workplaces within the community. Some of them are listed off in, I think it's 1B, so it's right at the start. It's I'll read them out. So it's basically male workers, young workers aged 14 to 29, tradespersons and people in lower skilled and manual occupations. And then this one is a little bit funny because I feel like it captures a lot of industries. Yeah. So individuals who are employed in hospitality, mining, agriculture, retail, manufacturing, construction, and financial services industries. So it feels like that's a really big audience. I guess the message or the takeaway from that is that there are lots of opportunities to engage with different workplaces on this topic.
Yeah, and it's going to be so specific to the LDAT's particular community.
Exactly, yeah. So getting AOD harms on the workplace agenda is one way to also start talking about this stuff. So engaging with those workplaces and start talking about why it's important, and like Laura talked about, getting those like what's in it for me around occupational health and safety, completing a workplace self-assessment. So this is talking to 4 sort of key focus areas that we've outlined in the toolkit around culture, physical work environment, personal health resources, and community connections. So we actually plan to go into those in more detail later in the presentation, so we'll leave that. But the toolkit lists out these specific 4 focus areas, and you can use that to sort of gain an understanding of them, but you can also use them to do a self-assessment. And there's links in there for, services that help with identifying areas where workplaces can talk about AOD. Yeah,
and just having those 4 key areas to think about, because it's going to be so specific to every workplace. It's not something you can do just with like a template. This is good guidance. But it does deserve some pretty significant thought from the management at that particular workspace to look at where their gaps are and where they can be doing better.
This is just a guide, I guess, for LDATs to be able to have something to start people off. So it's a tool. So supporting. So in terms of mapping your steps. Sorry, I got into culture for some reason.
Because we're so excited to talk about it in more detail.
So I guess with mapping your steps, just supporting with communication around these topics as they are implemented. So that's pretty straightforward. So measuring success. this is across all the toolkits, so it's not unique to this one, but basically the CAP specifies that LDATs are required to provide detail on 2 or more process measures and 1 or more impact measures on their activities. So have a look at that. We also have an evaluation toolkit, as I mentioned earlier, which you can use to sort of gain an understanding of what's the difference between process and impact. Also specifically to mention here that we don't expect you to measure outcomes, because that's really outside of the scope of the LDAT program activity timeframes. So you need a bit longer than 12 months to be able to measure that, and it's just too big a project to do. However, if some LDATs already have outcome measures in place for their activity, then we definitely want to hear about it. It can form part of your evaluation. But yeah, you're not required to do that. Also, if you have anything you notice about this toolkit as you go through it, or any of the other toolkits, please mention that to your relationship manager. We'd love to hear feedback. If there's anything that you think is missing, or anything that you have queries about, that's the way to go. Let your relationship manager know and they will pass it on.
Yeah, like if you're working with any really great workplace initiatives that you think would be helpful for other LDATs, we would love to add those into the toolkit.
Definitely. And in terms of measures of success for this particular toolkit, there's some examples in the back. So have a look at those, and there's also more detailed examples in the evaluation resource as well. Okay, so we just wanted to jump into those 4 areas that we're recommending workplaces could start off looking at. The first of which is culture. What's the culture of your organization as it relates to primarily alcohol, but also other drug use? And that really, having a good organizational culture really starts with having a good alcohol and other drug policy. Now, having a good policy isn't just about having something that's really well written from a legal perspective that kind of collects dust on a shelf. It's also about having getting input from your employees, making sure that it's communicated well, that it's communicated clearly, and that it's also communicated regularly. I mean, the policy isn't doing anyone any good if people don't know what's in it. If they don't know what the expectations and potential consequences are. So that step of like having a good, well implemented and well communicated policy is key. There's also the responsible provision of alcohol. So whether that's Friday night after work drinks, or it's a specific event, or it's a celebration that an organization is having for staff, following that good, responsible service of alcohol is really important. And that's also part of the leadership role modeling good behaviors. So all of this sort of falls under what is the culture of your organization? Is there a positive, responsible relationship that your organization has with alcohol? And I guess the thing to touch on there is that I think you can kind of start to see how you can use this table in the toolkit and these particular focus areas as a self-assessment, because you can start thinking about whether or not you have a clear, well-implemented policy, or whether you have responsible provision of alcohol at all the events that you do, whether or not leadership role modeling behaviour.
Absolutely.
So yeah, I think it's really clear once you start going through these in a bit more detail how they can become a self-assessment for a workplace.
Yeah, and I mean, look, it does also come back to that what we were saying earlier about when you're looking for partners, the what's in it for me angle. You can still raise those issues of, well, if you don't have a good alcohol and other drug policy, how are you meant to be transparent and fair in terms of how you respond to instances that come up? Because there can be, fair work and legal issues if you don't manage things consistently, transparently, and fairly.
And I guess in Drug Info, we've had people from employers call us and they've had an incident, and one of the questions we kind of ask is, do you have a drug and alcohol policy? And sometimes they don't, and so they have to try and figure out and navigate these situations without a clear policy.
Yeah, absolutely. Really tricky. Especially, if it's something that is a work-sponsored event.
Exactly. Yeah.
That can really become a minefield
or
for
even
employers.
Smaller businesses, like hospitality. I've had people from hospitality ring, and they have a staff member who's having some issues, and they want to be able to talk about it with them, but they don't really know how to go about it because this is the first time they're having to. So yeah, it's not just big companies that you can focus on. It could be smaller businesses if that's what's happening in your community.
Yeah, absolutely.
There's lots of different ways to sort of reach out to people and have an impact in that way.
Yeah, I think that's a good point.
Yeah.
And that is that does really feed into the physical work environment as well. Is the environment in which your staff is working an environment that promotes responsible alcohol consumption? Again, this is about events as well, right? Making sure that your events are following best practice in terms of a responsible service of alcohol. And that's things like making sure that there's food, that there's enough food, and also that you have non-alcoholic and low alcohol available drinks. And one of the things here that we wind up talking about is attractive non-alcoholic options.
You mean not just Sprite?
So that, having a choice between either having an alcoholic beverage or like a can of, what do you call it in this country? Soda?
Sure.
Cola?
Soft drink.
Yeah. That's not really appealing, but if you had, say, some really great mocktails, or like good non-alcoholic and low alcoholic options, it does make people far more inclined to access those options. And also safe transport. This is another big one in terms of the responsibilities of organizations to look after their staff. And part of that is making sure that, people aren't drink driving and that everybody gets home safe.
Mm-hmm. Great. Okay, so for personal health resources, I guess this is about providing information and opportunities for people. So talking about things like, what are the guidelines? What is best practice around how much alcohol one should consume throughout the day or throughout a week? What is in a standard drink? I think a lot of people still have misconceptions around what a standard drink is. So going out for a glass of wine after work may actually be more like 1.5 standard drinks rather than 1. So giving people an opportunity to discuss what those things mean and get an understanding of what the recommendations are from peak health bodies, I think is a really good idea. And that's recommended obviously in the toolkit. Talking about workplace policies, so if there is a workplace policy around alcohol and other drugs, having that available and, you could even put it up in places. So in the kitchen you could have a standard drinks chart and people can just look at it whenever they sort of go past or whatever. I guess also having support services promoted throughout the organisation. So that could be an EAP program, but it could also be alcohol and other drug support services. So there's multiples out there. The ADF provides drug info, which is an information and referral line. There's state-based alcohol and drug information services. So there's lots of places that can be listed within a policy or in a public place for employees to see and be aware of. And then also, I guess, talking about broader AOD education. And this can include managers. So from the perspective of a manager, you might want to provide training for how an organisation might want to respond if an incident happens. So if there's something at an event, or if an employee is going through a tough time, having a way to navigate that process with people in a fair and considerate way can form part of the policy and fits under this personal health resources banner, I guess. So that, there's a lot to think about there. Anything to add, Laura? I think
no. There's more detail to you in the toolkit, as always. Yes. More detail than we can cover.
Definitely. When it comes to community connections, which is the last sort of focus area, it's good to sort of talk about things like promoting good sports accredited organisations, participating in awareness raising months. I don't really know what to call them, I guess, events. So things like Feb Fast and Dry July, which Laura's mentioned before. And I guess that broad encouragement that external functions really align with the alcohol and drug policy. So I guess you could, as events come up, workplaces can encourage that people understand what the alcohol and drug policy is and what the expectations are, and then really role modelling that at events. So that kind of covers us off in terms of what is in the toolkit. I'll just put a call out for questions or comments if anybody has them. I think Laura's typing away for one. But while that comes through, I'll also mention that on the Community Hub, as I mentioned before, We have a suite of resources that are supposed to, well, they do interlink and can be used as a suite. So there is Building Successful LDATs, a practical guide. There's the Community Action Plan and the toolkits. There's also additional resources like the evaluation resource, the ethics resource, and the stigma resource coming soon.
Yep, that's right.
And there's also the AOD Lifecycle Planner, which is a sort of poster-sized document that outlines how the different toolkits can be used across different age groups. So we encourage you to have a look at that as well. And that's kind of it. Have we got a question?
Yeah, a great one from the Rochester and Elmore LDAT, who are registered and working through the Cancer Council's Healthy Workplace Achievement Program.
Oh, great.
Great to hear that you guys are finding it useful, and asking if this toolkit will also look to incorporate the other drugs element, like the Workplace Achievement Program does.
Okay.
Yeah, and it absolutely can. This toolkit is less about like the detail of what might be in a specific alcohol and other drug policy for workplaces, for example, but there's definitely scope for this to go beyond alcohol and also incorporate other drugs in terms of policy implementation, organizational culture. This toolkit I think is a bit broader, whereas to memory the achievement program is pretty detailed. I hope if that answers that. I mean, the other drug element could absolutely be incorporated in the work that the LDATs are doing, especially if that's a significant issue for workplaces in your community. I think that would be a great idea.
Yeah, definitely. Cool. I think that covers it off. We're a little bit early. I don't know if there's anything else that I really want to say. I think we've covered it off pretty well. Is there any other additional comments or anything, Laura?
Not yet. But if anybody has questions after the fact, or are just interested in more what other detail and support could be provided, it would always be the relationship. Get in touch with your relationship manager first, and then if it's big, hairy question, may come back to us.
I guess if anyone's watching this after the fact, which is the whole point of webinars in a lot of ways, you can watch it whenever you want. If you have questions that come up later, you can do the same thing, reach out through the relationship manager. Alrighty, thanks everybody, and we'll see you at the next one. So just to give you a little bit of a heads up, in June our webinar will be a double episode. I don't know what to call it, but basically we'll be presenting on 2 resources rather than 1. So it will run over an hour, and you can register for the whole thing and then just attend the one that you are interested in. So pass that on to people that might be interested within your networks. But we will be sending out an EDM as usual with the Eventbrite link so that you can register. But keep an eye out for that. Thanks for joining us.